the evidence is clearly and plainly available in abundance, validating the effectiveness of KN95, N95 masks, or the Korean ones you mentioned, to protect against what is clearly shown to be an aerosol virus transmitted not through touch but through our breath and the air. Why do you think bodies such as Public Health and the World Health Organization have not publicized the widespread use of KN95s and N95 safeguards when they clearly provide the best protection against short-range transmission?
That's unfortunate indeed. I mean, and it's not too clear why. I mean, I think in the case of the World Health Organization, when we talk to them, they're always worried about low-income countries and, what can they do in Zambia and in Namibia and in, Myanmar and whatever. And they don't want to say that something is needed that is just not available everywhere. So from the point of view, they are more conservative, I think, for that reason. They have finally said that they do recommend N95 masks in clinical settings, but they recommend them. They don't say they are essential or something like that. In the US, it's more confusing because, the N95 masks are available, and there are American manufacturers have millions of them, and yet the government has also been shy. They have said they are the best, but they seem to think that they are uncomfortable or something, and in ways that don't make any sense to me. And I mean, I think partially the people in charge are the people who all their careers had been raised in thinking that this was a droplet, that droplet diseases, respiratory diseases were transmitted through these droplets that affect the, and they haven't yet understood just how big of a change this is. That no, we're breathing this virus in this one and all the respiratory diseases, and so I think they don't quite grasp just how important the N95s are, and then there's also kind of political reasons maybe that they think is. I mean, I think, for example, in the CDC that I know better is like both with the previous president and with the current one is driven more by the White House and the political needs of the next election, that kind of thing, than by science, or as much. So, and I think they feel, so they have distributed free N95s and things like that, but they don't want to mandate them or something like that because they think maybe there'll be a political backslash. That's my guess. I mean, and it's very unfortunate because if we had distributed them and required them and insisted and explained over and over about the fit to the face, that really would have made a huge dent on transmission, and we would have saved many deaths, many cases of long COVID, but we are where we are.